Hello, nice to meet you. This is a Medicare review. Now, keep in mind that there will be changes to the Medicare program for 2025 that have not been released yet, such as the Medicare Part B premium, the Medicare Part B deductible, some other co-insurances or co-pays. Those have yet to be disclosed for 2025, but we'll cover all the basics or many of the basics here today. And then at the end, if you have any questions, I'd be happy to answer them. All right. Well, let's see if we can. Good. Okay, so a disclaimer, Medicare is a big subject and impossible to cover in one short meeting. For a full explanation of Medicare, consult Medicare and You, published by Medicare. There's the website. And at the end of this presentation, you can ask me any questions you have. All right, so there's different types of Medicare. We have original Medicare with Part A, hospital, Part B, doctors. Usually, the first thing a person does if they choose original Medicare is add a drug plan to it, which is optional, and the Medicare supplement. Now, one word on the drug plan. Many of you probably have a Medicare drug plan. It's very important to look into your drug plan every open enrollment from October 15 through December 7th. The reason is because the drug plan formularies can change on a year-to-year basis. In addition, the premium can change. It's not hard to look into the drug plan to see which is the best deal or program for your circumstances. Medicare.gov is the search engine I use for my clients to research drug plans, and you're welcome to go to Medicare.gov and research drug plans. Medicare supplements, we'll cover that a little bit more in more detail in a few minutes. And then the third kind of program is a Medicare Advantage plan. This is the one you see on TV. This is the mail that you receive regarding Medicare. Two types, HMO, which means Health Maintenance Organization, and PPO. We'll be covering those in more detail in just a minute. Okay, so original Medicare with a Medicare supplement. So with original Medicare, you can see any Medicare doctor in the United States. And that's very important. Most doctors are Medicare providers. Not all, but most. And probably every hospital. And the reason, of course, is how could a doctor be in business if they didn't cater or support the senior market? So most doctors are Medicare providers. It doesn't matter if you see a provider in California or Texas or New York. You can go to any of them. There are different types of Medicare supplements. Plan G currently has the richest benefits for anyone who is new to Medicare since 2020. For those of you who had Medicare before 2020, you might have Plan F. If you have Plan F, you might want to compare the premium to the current Plan G premiums and see which is a better deal for you. Just call your broker and ask them to do a comparison. Now, with original Medicare and a Medicare supplement, hospitalization. So you pay zero for covered services in the hospital. For doctors, you pay nothing except the annual $240 doctor deductible, which is amazing. So if you had a hospitalization and the bill was $500,000, if all those services were covered, you'd walk out of the hospital owing $240. The premium. There is a monthly premium for Medicare supplement plans. By the way, Medicare supplement is also known as Medigap. So either one of those terms means the exact same thing. And the premium is based on your age and zip code. The premium usually increases every year. In California, for Medicare supplements, there is something called the birthday rule that permits you to change your Medicare supplement from your current plan to another plan of equal or lesser benefits. You can even change companies. The window is 60 days from your birthday. So this means if you were born on February 1st, you have 60 days from February 1st to research other Medicare supplement plans in your area And if there's one that offers the exact same benefits, but at a lower premium, you can switch to that new lower premium plan, no medical questions at all. Guaranteed right to switch. It's called the birthday rule. Another opportunity to enroll in a Medicare supplement plan is if your Medicare Advantage plan has increases in premiums, co-pays, or co-insurances. Every year, if you have a Medicare Advantage plan, every year you get something called the annual notice of change. And this is your notification of any changes in your Medicare Advantage plan. Look that over. And if there are changes in it, it opens up a special enrollment period for a Medicare supplement plan if you're so inclined to change to a Medicare supplement plan. All right. Now, Medicare Advantage plans, as mentioned before, there are two kinds. One is called a PPO. That means Preferred Provider Organization. And with a PPO, you can see any doctor who is in the PPO directory. Never ask the doctor, do you take Medicare? That's just going to get you in trouble. Your doctors are in the PPO directory, not the Medicare directory. So if you see a doctor who isn't in the PPO directory, you'll pay a higher portion of the bill. This is one of those areas where people trip up with their Medicare. They have a Medicare Advantage plan. They're referred to or told to go see a specific doctor. They go in there. The doctor's office says, do you have Medicare? They present the Medicare card. They get services, and they end up paying for it. And the reason why is when you have a Medicare Advantage plan, you're not accessing the Medicare doctor network anymore. You're accessing the insurance company's network of doctors. So you don't want to ask, do you take Medicare? You just want to have your insurance card and say, do you take ABC PPO plans? Something like that. Okay, so for doctors, there is a copay or co-insurance. Copay means a specific dollar amount, $10 to see a specialist. Co-insurance means a percentage, 10% or 20% for an MRI. So copays or co-insurance, and Medicare PPO plans do have copays and co-insurance. If you're hospitalized, you will have a copay or a co-insurance for your services. There's also something called an out-of-pocket maximum. This is important to know because you want to know, when does your responsibility for payments end? Is there a ceiling? And that's called the out-of-pocket maximum. Many PPOs include a drug plan. Some include dental and vision and other benefits. Now, if your Medicare Advantage PPO includes a drug plan, make sure that any prescriptions you're taking are included in that drug plan's formulary. This is essential, or else you're going to be surprised with bad news. Okay, Medicare Advantage HMO. By the way, I hope you're taking notes if you have questions. So with a Medicare Advantage HMO, you choose a primary care doctor. You see that primary care doctor for everything. If you need a specialist, your primary care doctor will route you to a specialist in their group. Never ask the doctor again, do you take Medicare? If you have a Medicare HMO, you don't have access to Medicare doctors. You must see your primary care physician or a specialist in the HMO group. If you see a physician outside of the HMO, you will pay 100% of the bill. Many HMOs also include a drug plan. And again, if you have a Medicare Advantage HMO, make sure that any prescriptions you take are on the HMO drug plan formulary. And Medicare HMOs also include dental and vision and other benefits. Now, some of those other benefits are very nice. They can be free gym membership, transportation to medical facilities, sometimes meals if you've been hospitalized and return home, a credit for purchases at a pharmacy for things like toothpaste, toothbrushes, bandages, cold medicine. So there's a lot of nice little extras included with some of these Medicare Advantage plans. Okay, here's just a diagram of how an HMO works. So in the center, you have your primary care physician. You always see that person. That person routes you to specialists, cardiologist, urologist, etc. It's called a referral, and you must get that to see those specialists. Okay, now we are coming up to what is called open enrollment from October 15 through December 7. During open enrollment, you can change your drug plan. If you have what is called a standalone drug plan, you can change it. You can change your Medicare Advantage plan, whether HMO or PPO. You can leave original Medicare and join a Medicare Advantage plan. So if you have original Medicare right now with a supplement, during this open enrollment, you can leave that and join a Medicare Advantage plan. Or you can leave your Medicare Advantage plan and return to original Medicare. And all that occurs between October 15 and December 7, and any changes you make during that period are effective January 1. There is another open enrollment from January 1 to March 31st, during which you can switch from one Medicare Advantage plan to another, or leave a Medicare Advantage plan and return to original Medicare. So there's two open enrollments. One, the regular open enrollment, and the second one for people who have a Medicare Advantage plan, and that's from January 1 to March 31st. And any changes you make during that open enrollment period are effective the first of the following month. So, for example, let's say it's January 15th, and you have a Medicare Advantage plan with ABC Company, and you find out that there's a plan with XYZ that you like better. So on January 15th, during January, you could switch from your ABC Medicare Advantage plan to the XYZ Medicare Advantage plan, and it would be effective February 1. Now, you don't get a lot of communication on this second open enrollment period because insurance brokers are prohibited from mentioning this in the effort to get you to switch your plan. So you just need to know that this opportunity exists. And if you'd like to take advantage of it, contact your insurance broker and they can help you. Okay, let's see here. Okay, covered that one. Okay, I think we covered all the basics there, Allison.
Okay. Then we can open this up for questions.
We'll open it up for questions.